For the non-surgical nose job with filler, it's a very interesting procedure where we can use the filler to replace the nasal bone projection in the nasal bridge, and it will give kind of a natural contouring for the nasal bridge, and as well as sometimes also shaping of the columnar part of the nose, so it gives it more of elongation, thinning in an indirect way, and elevation, especially when it comes with the eyelashes. Usually the bridge of the nose, or actually the root of the nose here, it's preferably to be at the level of the eyelashes. It gives a nicer shape and gives a thin looking nose. So I start usually with the marking of the contour of the nose, and here it comes from the other side. I just try to make sure that it's actually in the center. Yeah, and then this is the center of the nose, where I'm going to work on the columnar part to make it more longer looking, so it will give it also thinner look. That's all about it in her case, because she doesn't have any major problem in the shape of the nose, except that the bridge is a little bit low. Okay, you okay? We can start. With the injection, we go for the extremely high, super reticulated type of filler, whatever it is, and then I go all the way deep to the subperiosteum. At least I had the bone, start injecting, and I usually use the two fingers, the thumb and the finger, to localize the filler. I don't want it to go right, not left. And I give the proper quantity at the beginning, means how much lift I want to create. I think I have lifted it in, yeah, that's the way I want it to be lifted. I will model it later, and then I go again, hit the bone, give a little bit less, and then I go again and give even less. Now I finish from the top, change position, and I go from down up. And now I complement whatever I've done from the top. And again, now I give it a little bit more. This is the modeling of the filler that should replace the bony projection. It's already lifted, contoured. Still I need to do some changes, but I think it's good. I'll just work on the root of the nose, because it gives a projection of even the forehead area. Alright, so the bridge of the nose is done. I just want to work a little bit on the columnar side, which is this part of the nose. And in this case, I just try to pull the upper lip, hold the columnar in my hand, and between the two finger and thumb, and give it a little bit of volume. Go all the way down to give it also support. Are you okay? No. Yeah, because this is a little bit painful. And then I come out, try to model it. Now the best way of modeling, by swap. done. Did I hurt you? No. Good. Of course, we can use the filler to fix any defects, some of the defects of the nose, not only for a cosmetic reason, but of course it won't replace the effect of a surgical rhinoplasty. Now looking at her from the profile, it's very straight and natural, and face to face it has been lifted. As I said, can you open your eyes? The level of the eyelashes now is somehow the same level of the nose bridge.